Okay, so today we're going to be talking about Indigenous sovereignty and sex education, just basically a safer sex overview because everybody could definitely use that. And I know we're talking about Sexual Assault Awareness Month, but along with that, we should know what brings us joy, what makes us happy and fulfilled, and what kind of healthy relationship or relationships we want to be in. I did my introduction already. So some community agreements for the space that we're sharing. Don't yuck my yum. Basically, that means don't say ew, gross, or nasty, because I am going to be talking about different body parts, different types of relationships. Everything's different. What I like, you might not like, and what you like, I might not be into. And that's totally fine, right? Everybody can be into whatever they want. But we're not here to make anybody feel bad. We want to be respectful. So no ews or nasties. And what's said here stays here. What's learned here leaves here. So just so you know, this whole lesson is going to be streamed on Facebook. I don't think they can see the chat, right? Kelsey, do you know?
No, Facebook cannot see the chat.
Okay, so, well, just so you know, for your safety and also just for confidentiality, the chat is visible to everybody. If you do have a question that you want to ask, but you're afraid to ask, feel free to message me directly and I can check that out myself, or also message Trevor too. All right. And take care of yourself. Like Kelsey was saying, if you need to step out, if you need a drink of water, use the restroom, anything like that, go for it, do it, take care of yourself. We don't see anybody else's screen, so you don't have to worry about having to show your face or anything. And you have the right to pass, but I'm not going to really be asking anybody questions because I can't see anybody. And assume positive intent, but own your impact. We're all here to learn, and we're all at different levels. So we don't want to make people feel bad. And like I said, we're all here to learn. If you have a question, ask it, because I guarantee another person has that same question. And is there anything else we want to add to our community agreements today? Okay. If you do want to add anything, feel free to put it in the chat and we can add that. And if you have any questions, like I said, unmute or no, you can't unmute. If you have any questions, put it in the chat. Or Kelsey?
Yeah, so there is a raise your hand feature. So if you ever want to raise your hand, you're more than welcome to. And then we can either unmute you or you can put it in the chat.
Yay, so we can hear people. Okay, you can raise your hand. Yeah, like Kelsey said, you're more than welcome to chat it in too. You can also direct message me, Kelsey, or Trevor, and we can ask that question without saying who asked the question. And if you have any sexual health questions after this, or if you have young people in your lives, have them text PPNM to 57890, and there's sexual health educators on the other end of that text line. So we get a lot of questions like, is my penis supposed to be this big? What does chlamydia do? I think I have an STI, where should I go? So if anybody has any questions like that, they're more than welcome to text that line. Okay, so here's our agenda. We're going to be talking about like STIs, what's the big deal with them. We'll do a condom demo. We'll talk about birth control. You'll learn what fries is later on. And then if you have any questions, we can get to those. So can anybody tell me what a sexually transmitted infection is? Anybody? Yes, can be treated. Some of the infections someone might have to live with them. Yeah. Okay. So an STI, also known as STD, both of them are the same, doesn't matter, is an infection that can be passed during sex or genital to genital contact with an infected partner. So that means one person has to be infected with an STI for it to transfer to another person. Now, I have a question. If two people after school and high school are having all this sex, but neither of them have an STI, can they create an STI with all that sex they're having after school every day? Someone said yes. Yes, of course. Sorry, y'all, no points for you. No. Yes. No. No. So no. Okay, I keep looking at the chat, sorry. So no, you're totally correct. Two people who don't have STIs cannot give each other an STI. One person has to be infected with an STI for it to transfer to the other person. All right. So two people who are having sex and they both don't have STIs, they're not going to create something out of nothing. So that's why it's super important to get tested and to know your status if someone has an STI. And I also see in the chat too, and not unless they're with another infected partner, that's how an STI can come into a relationship if someone is in a monogamous relationship, meaning just two people in agreement to be together. If they are cheating, which is unfortunate, but it happens, and that other person has an STI, that's how the STI can be transferred to their partner too. So yeah, it happens from like a chain of events. If someone is having sex with multiple partners, they want to make sure that they get tested and use condoms or other barrier methods, and we'll get into that later. So I want to talk about two types of STIs. There's curable STIs, meaning once you get the medication for it, you take it like you're supposed to, you can be cured of those STIs, meaning you won't have it anymore. And then there are treatable STIs, meaning those are the ones you might have to live with for the rest of your life, but nobody has to die from them, and we'll talk about that. So bacterial infections, when someone has a bacterial infection like strep throat, what does a doctor give you? If I had a strep throat, which is a bacterial infection, yes, definitely antibiotics. So when someone has a bacterial infection like syphilis, gonorrhea, chlamydia, or trichomoniasis, the doctor will give them antibiotics. And if they take their antibiotics like they're supposed to, that should totally get rid of that STI. All right. It's usually about a week's worth. The doctor does recommend to not have sex while taking the antibiotics because you want to make sure that you're not transferring the STI or also receiving another STI. So you want to make sure that you're taking your antibiotics like you're supposed to. If you do, then you should be cured of the STI. Now, pubic lice is different. It's parasitic. So parasitic meaning parasite, it's like a bug. Pubic lice lives in hair. So think of lice on the head. The pubic lice is going to be lice in the pubic area. Now, if someone has pubic lice, what should somebody do? How do you get rid of pubic lice? Crab oil? No. Burn it. You want to burn your pubic hair? That's going to be painful. Comb or topical? Thank you. Yes. So you want to comb out, and then you also want to use topical treatments. So lice shampoos, you can definitely use that, not just for your head, but also in the pubic hair area if needed. I also see shave. So typically when someone has lice in their head, people don't usually shave their head. You don't have to do that for your pubic hair as well. Also, if you're just shaving off the hair, what the pubic lice does is they lay eggs under the follicle, meaning under the skin, into the follicle of your hair, the root. So even if you're shaving it, you're not getting to those eggs under the skin. So you definitely want to use topical treatment, and also you can comb it out as well. All right. So that's going to be bacterial infection and parasitic infection. Trichomoniasis is also an infection that has like parasites in it too, but antibiotics gets rid of that one too. All right, so let's move on to treatable STIs. So the first one is herpes. There's two types of herpes. There's simplex 1 and simplex 2. So simplex 1 is going to be oral herpes. That's around the mouth area, right? And then the second type is going to be genital herpes. So what herpes is it's infection that lives on the skin. So it's living on the skin, and it lives in the skin cells. So the way that it gets transferred is from skin to skin contact. So if someone had oral herpes on the mouth, which is also known as cold sores, they're known as cold sores too, because when someone has a cold, their immune system's low, meaning that infection might pop up and be visible when they have a cold. All right, so if someone has an outbreak of cold sores or oral herpes, that's when it can transfer to another person from kissing, from sharing drinks, putting my mouth on it and giving it to my friend, or even using chapstick. So if I have chapstick or lipstick and I share that with other people, that's how it can transfer as well. And it can transfer to the oral area or genital area as well. So if people are having oral sex, mouth to penis, mouth to vagina, mouth to anus, and either one has an infection or outbreak of herpes, then it can transfer either way, or genital to genital contact, meaning if someone was having penis to vagina sex, that's another way that it can transfer. Now, herpes isn't deadly unless you're a fresh newborn baby. Other than that, people can live with herpes for the rest of their lives. There's topical treatment. It is uncomfortable, but again, not deadly. About 90% of the whole wide world population has some sort of herpes. Some people have herpes and never experience outbreaks. Some people might have more painful outbreaks than others. It just depends on the type of herpes people have. Now, I know I'm talking a little bit fast. Does anybody have any questions so far? Okay, feel free to keep ask anytime. We're gonna move on to HPV. What percentage of the population? So I only know that there's 90% of the world population. So across the world, 90% of people, a lot of people have it. Yeah, I can look more into like how many people have it here. Like I said, it's very common. If people, like I said, it's not deadly, and it's also kind of political too, because it got super big during the Reagan era. During the whole time there was like the STI scare, they really pushed herpes into being like a scary disease. Like it's really bad to have, but it's just unpainful bumps on the genital area or the oral area. And if people are worried or want to know how to prevent this from, getting herpes or anything like that, we'll talk more about that when we go into barrier methods. Okay, awesome. So HPV stands for human papillomavirus. There's over 100 strains, and it causes different types of cancers, and it also causes genital warts. So genital warts is going to be different from herpes. Herpes is like, might be a lot of bumps. Wart is just going to be one little bump. Can be painful, can be a nuisance. If people do have a genital wart, they definitely want to go to the doctor and get that removed. Don't try to go to Walmart and get some wart removal and try to remove it yourself. The genitals are very sensitive. You definitely want to go to a doctor and have them remove it. Now, as far as the different cancers that can happen with HPV, the most common is going to be cervical cancer. And it can also cause penile cancer and throat cancer. So thinking about the different types of sex people are having, that's how it can transfer. So someone having with a penis can transfer HPV to another person with a cervix, and also to the throat area as well. I believe it also can cause anal cancer too. So yeah, HPV, there is a really great vaccination called Gardasil. It's a series of 3 shots. It is available for folks as young as 9. And they do recommend people getting this just to make sure that people are safe, because it does cover 90% of genital warts and 70% of those cancers. A lot of people can still get the Gardasil. They refrain from going, they kind of not tell people over 30 to get the Gardasil vaccination, just because, if you're over that age, you probably have some sort of HPV. Now, HPV can go away on its own. It just depends. That's why it's super important to go and get a pap smear. Especially when you're older, after 30, you definitely want to make sure you're getting those pap smears and talking to a healthcare provider and getting tested. Yes, Gardasil. And then, so that's HPV. Hepatitis, there's lots of different types of hepatitis. They go from A to G, but the most common are A, B, and C. Now, there's vaccinations for hepatitis A, hepatitis B. Some of you may have had it, got it when you're younger. It's a part of getting vaccination shots, but hepatitis C has no vaccination shot. Now, hepatitis C travels through the blood. And so what it causes, what hepatitis does cause is liver failure. So if someone does have hepatitis C and they don't get treated for it, it can cause death, because it can cause liver failure. And we definitely need our liver. So people who do test positive for a hepatitis C can go in for treatment. And now there's a great cure for it as well. It's a series of it's a series of pills that people take, and it gets rid of the hepatitis C. Here in New Mexico, Department of Health is doing a great job on providing and making it accessible to get that treatment. So that's hepatitis C. The most common way that it is transferred through is through sharing needles. And so that's why it's super important to let people know about needle exchange so that people can get fresh needles and they don't have to share. And if someone is positive for Hep C, say they're having risky sex, maybe they're not using condoms, and there's a tear on the penis or anywhere within the genitals, that's how that disease can transfer, is through blood. All right. And any questions so far about HPV, hepatitis, herpes? All right, we'll move forward. So last one is HIV. So HIV, what it does, it attacks your immune system. All right, so when someone has a cold, your immune system is going to go into overdrive to get you healthy. So people think that HIV itself kind of destroys your body and kills somebody, but it doesn't. It actually destroys the immune system, the white blood cells. So when someone has HIV, if they test positive for it, it's kind of like Pac-Man, eating away at those white blood cells, those white dots. So if it eats away at enough and someone has a white blood cell count of 200 or below, that's when someone will be diagnosed with AIDS. And AIDS can be tricky and scary because sometimes people can't bounce back if someone catches a cold. So when people have AIDS, it's harder for their immune system to kick back up and go into overdrive because there's not enough white blood cells. So when someone does test positive for HIV, it's important that they get on the treatment plan if possible. People can live long, healthy lives with HIV. I'm trying to think of the basketball player's name who has HIV. Anybody? Help me out. Magic Johnson, thank you. Yes, I went blank. But Magic Johnson has had HIV since the early 90s and is still alive, very healthy. Magic Johnson does take care of themselves. They do work out, eat healthy, and they take their medication. And also the medication has definitely gotten a lot better and easier for people to take. When someone does take medication, it puts the virus to sleep, so it's not eating away at your white blood cells. And we do have the U equals U campaign, so that's undetectable equals untransmittable, meaning if someone is taking their medication like they're supposed to, it can put that virus to sleep and it's not awake. And so people who are untransmittable or undetectable, that means that they can have sex with other people and not transfer HIV that way. Pretty cool, huh? So that's U equals U, undetectable equals untransmittable. And that's if people are taking their medication. There's also a really cool pill called PrEP, pre-exposure prophylaxis. It's kind of like birth control, prevention of pregnancy, but PrEP is prevention of getting HIV. Now, it's a pill that you take every day. You want to make sure that you're taking it like you're supposed to. Not skipping days or anything like that. And it prevents someone from getting HIV either through sex or any other ways people can get HIV. Now, before I finish that, I want to ask, what are the 5 fluids that HIV can travel through or be transferred through? Blood, semen, yes. Breast milk, semen again, yes. 2 more. Vaginal fluid, 1 more. Everybody has this fluid. Yes, anal fluid. Good job. So semen, vaginal fluid, breast milk, blood, and anal fluid. All of these fluids can transfer HIV. It's a lot of fluid. Some people ask me, what about spit? Spit you cannot transfer, so you can definitely make out with someone who is HIV positive. Some people ask about sweat. Sweat is totally fine. Boogers is fine. Tears is fine. Just some common responses that I get. But yes, it's those 5 fluids: semen, vaginal fluid, breast milk, blood, and anal fluid. Now people ask, anal fluid, do we really have fluid in our anuses? Yes, there's just a little bit. What it does is it helps lubricate the anus so that when you poop, it doesn't hurt. So you should be thankful for your anal fluid or else pooping would be very painful if we didn't have it. Okay, any questions about STIs? Okay, we'll move forward. Okay, so how do people know if they have an STI? Could be smell, itchy, burning, yes. Burning, testing, yes, getting tested. So there are symptoms that are related to all STIs, like itching, burning, sensations, smells, maybe painful sex. Those are definitely symptoms, but most STIs have no symptoms at all. So that means when someone does contract, say chlamydia or gonorrhea last week, this week they probably don't have any symptoms, right? They're not going to feel maybe painful sex or itchy or burning sensation because it's only been a week. But they can have the infection inside of them and can transfer that infection to another person. So we can't just rely on physical sensations or symptoms. It's important to go and get tested, because right now, 1 out of 2 sexually active people under the age of 24 will get an STI. So that's about 50% of sexually active people. Again, it doesn't have to be scary. It doesn't have to be deadly. A lot of these STIs are very curable. And then for the most part, treatable. Like there's a big stigma around STIs and why people don't want to get tested because of that fear, right? If we talk to young people about how it's okay to get tested, there are symptoms, but we need to let people know that the most common symptom is no symptoms at all. And I see some more: rash, discharge, lesions. Yes, definitely. So we want to make sure we tell people to get tested, and getting tested is pretty simple. People can go to IHS, your local health clinic. And what they do is they'll do a pee test. So you pee into a cup. Super simple. That's the urine test. A swab test. Now, this is where you want to make sure that you're being honest with your healthcare provider. They'll ask what types of sex you're having. Let them know if you're having oral sex. Let them know if you're having anal sex and vaginal sex. Because if you're not saying if you're saying you're not having oral sex, then they're not going to swab your throat, meaning that STI can still be in the throat area. So you want to make sure that you're letting them know what types of sex you're having and where you're having sex at, on the body area. And then you're going to do a finger prick, and that's going to be an HIV test. That's usually about 1 minute, 2 minutes to 20 minutes. It just depends on the test. And then for a more substantial STI testing, if you want to know what's going on, you can get a blood draw. Any questions around getting tested or symptoms? Okay, we'll move forward. Okay, and here it is, where to get tested. So you can go to Department of Health or Health Department, campus health clinic, telehealth. So we'll talk about that on the video that I'm going to show, but telehealth is basically having a self-testing home kit sent to you so that you can test yourself in a private space, wherever you're at. Maybe that's a dorm, maybe that's your home, maybe that's at your job, if possible. So basically, they'll send you a self-testing kit for STIs. Planned Parenthood, it says HIS, but it's supposed to say IHS. I'm sorry. That's IHS, Indian Health Services. And other Indian health centers, like, for example, here in Albuquerque, First Nations Community Health Resource. So I'm going to play the video. It's a TikTok.
Self-testing sexually transmitted infection test. All of this came in my kit. I got from Planned Parenthood of Rocky Mountains. Pee into cup. Use syringe to suck up urine and fill up tube to the line. Then put tube into small bag and into large bag. Stew this. Don't forget the date. Phew. Skoden. I go to post office. Hey to me, get tested and know your status.
Yeah, so that's how the self-testing kit works. I made that. I also sent it in. I really did.
Self-testing.
Okay. All right. So we talked about barrier methods and how a lot of the STIs can transfer. Again, one person does have to be infected, and there are ways to help prevent or reduce the risk of getting an STI. So here at Planned Parenthood, we like to say external condoms and internal condoms. External meaning it's going to go on the outside of a penis or a dildo. Internal meaning it's the internal condoms. They call them female condoms, We don't like to call it female condoms because not everybody with a vagina identifies as a woman. So we just call them internal condoms. And then also dental dams. All right. Oh, wait, I think I'm going to do the condom demo now. Okay. All right. Okay. Oh, Ryan with Planned Parenthood in Durango. I know Ryan. All right, so we're going to do the condom demo. Okay, so before I open my condom, what do I need to check for? The seals. Any holes, expiration date and holes, yes. So this condom says February 28th, 2022, we're good. So this one's good. And I'm gonna check for holes. Now the way you check for holes is checking for the air pocket, the air bubble. And this one feels good. It feels like there's air inside, so I'm gonna open it. Now I'm gonna open it with my fingers, not my teeth or not a knife. People ask, why not my mouth? You know, you want to make sure you're not going to rip it with your teeth. So it's just safer to use your fingers. Now here is the condom. It's like a makeup tutorial. Here we go. So it kind of looks like a baby bottle top, right? You want to make sure that it's like a beanie or a cowboy hat with the rolls coming up. So it's not the other way around. You want to make sure that it's going to roll down a penis easily. So it looks like a cowboy hat with the rims, the rolls coming up. And I'm going to pinch the condom like this so that I can put it onto the penis easily. Also, I'm creating room for the ejaculation. If I just put this on like that, where do you think that ejaculation is going to go? Anybody? It might just shoot through or out the back, but usually if it's like that and it's super tight, that pressure can make it bust through, because when someone ejaculates, it travels at 24 miles per hour. That's faster than a school zone, y'all. That's pretty fast. So you want to make sure that there's enough room for the ejaculation when someone ejaculates. So I'm just going to pinch the tip like this. That's why there's a tip like that. It's room for the ejaculation. Then I'm going to roll down the condom all the way down until it can, as far as it can go. And Woody is now ready for sex. Yay! So what can tear this condom during sex? Yay, Woody! Friction, yes. That don't sound very pleasurable or nice, right? Can you hear it? So I want to add lubrication to it. Yes, certain lubricants. So this is a latex condom. I want to make sure that I'm going to add water-based or silicone-based lubricants. All right. Those lubricants are good to use and safe to use with latex. If I use something like baby oil, lotion, any kind of body oil, anything with oil in it is going to break down the latex, right? So I want to use water or silicone-based lubricants with condoms. Also, those are safe to use inside the body because they're made for inside the body. If somebody's using stuff with a lot of perfume, like Bath and Body's lotion, that perfume can cause an infection or mess with the pH balance inside a vagina or an anus. So you definitely want to use stuff that's made for inside the body. Teeth? What? Oh, breaking it. Yeah, so if you're using condoms for oral sex, make sure that you're not biting the condoms, because that can definitely rip it. I also see piercings too. Usually a lot of people with piercings, as long as they're making room for ejaculation making room for the ejaculation and also adding enough lubricants, the condom won't break with piercings too. Okay, so after ejaculation, Woody's not going to stay hard, right? Woody's going to turn flaccid. So this condom's not going to stay on. So some people just want to like chill out, relax, cuddle, but it's a good idea to clean up afterwards because this condom could fall off. So after ejaculation, Woody's going to go to the bathroom and then hold the head of the penis and then take the condom off. All right. Fluid still inside. You can tie it up if you want, and you're going to throw it away in the trash can. not the toilet. Don't flush it, all right? Because it can cause some plumbing issues, so definitely in the trash can. And our next condom, well, does anybody have any questions about condoms? External condoms. There's no age limit for condoms, and that's a federal law, and that's for safety issues. If younger people are sexually active, even if younger people are experiencing sexual assault, their condoms are always accessible for anybody at any age. All right, moving forward. So here is the internal condom. Now this one's a little bit different, and it's also not as accessible as the external condom. You can't go to Walmart or Target to purchase one of these. The pharmacy has them, and if you ask your healthcare provider, they should have them. Usually at health fairs too, or Planned Parenthood or other health clinics, they do have these. They're expensive. They did raise the price, but insurance does cover it. Now with this one, it's the same thing. You want to make sure you're feeling for that air pocket inside so that there's no holes. And the expiration date is going to be in the flap on the side. And this one I'm going to open with my fingers, and I'm going to pull this out. All right. Now this is the internal condom. Obviously, this is a lot bigger, and it doesn't go on a penis. This is going to go inside a vagina or an anus. Now, if someone was planning on having vaginal sex, there is a ring that's inside, very flexible. What this ring does is it helps a person push it into the vagina, either themselves or their partner. So you can twist the ring like this. Here's the outside of the vagina, which is the vulva. Here's the entrance into the vagina. You would push this into the vagina as far as it can go. This large outer ring hangs outside of the vagina. A penis can go in here or a sex toy. And then after ejaculation, you're going to twist this up. So this hangs out inside the vagina like this. This ring kind of helps anchor it inside. But if the ring is uncomfortable, once you insert it, you can pull that ring out. But I've also heard that the ring is very pleasurable to a penis. This large outer ring hangs outside of the vagina, so it covers a little bit of the labia. And also this large outer ring adds a little bit of pressure to the clitoris, so that can also be a little bit more pleasurable. The cool thing about this condom is that it can be inside someone for 6 to 8 hours. So if someone was planning to go to prom or go to a dance or a date, they could put this inside prior and be ready for sex. Again, this one, you're going to twist it, pull it out, throw it away into the trash can. This is a non-latex condom, so people who have latex allergies can use this. If someone was planning on having anal sex, you don't want to have the ring inside. So you take the ring out for anal sex, and it would work a little different. So you're going to kind of bunch it up like this. And then here is the anus, the outside, or here, let me use this hand, sorry. So here's the anus. So the penis would push it in. The penis would be the one pushing it into the anus as far as it can go. And this large outer ring would hang outside the anus. So it's adding protection around the anal area as well. All right, same thing, penis goes in here or a sex toy. After ejaculation, you're going to twist it up, pull it out of the anus, and then throw it away into the trash can. Oh, my hands are all oily now. Does anybody have any questions about the internal or external condoms? No. Okay. So yeah, that's how condoms work. And the dental dam, I don't have a dental dam, but it is a thin latex sheet and it goes over the vagina or an anus for oral sex. So if someone was having mouth to vagina sex, mouth to anus sex, you can put a sheet of the dental dam, the latex, over, and that prevents that skin to skin contact. If people don't have any dental dams around, which are also not as accessible, you can use saran wrap. Oh, thank you. Thanks. My awesome coworker is giving me some hand wipies. All right. Okay, so let's see, we'll move forward. Let me share my screen again. Y'all are so awesome. Oh, I also saw in the chat, someone had something in the chat. What is the cost difference? Like I said, The internal condom it's pretty expensive. It's about $7 to $9, but sometimes at health fairs, you can get lucky and find some free ones. I do want to add too, with the internal condoms, they do take a while to get used to. The recommendation is to practice, to try it out to see if it's something for you. If not, maybe stick to external condoms because they're a lot easier to maneuver around. External condoms, they can range anywhere from free to pretty pricey. It just depends like on brand, where you're getting it. If someone's going to a gas station, it's obviously going to be expensive. I remember one time I went to the gas station and for a 3-pack of Trojans, it was like $10. I was like, what the heck? This is pricey for 3 condoms, $10. So it just depends where you're going. Again, if you're at a health clinic, if you're at Planned Parenthood, or even a hospital, they usually give out free condoms. Target, Walmart, anything like that, they sell condoms pretty cheap too. I saw at Costco, there was like a tin of 100 condoms and it was like $15. And I was like, whoa, that's like a really good deal. So just keep an eye out. Oh, great question. Do they need to be name brand? No, a lot of the condoms are pretty safe to use. But everybody likes name brands. It's like people like Jordans, people like Nikes. It just depends what you like. So, they're like shoes. It's good to try out to see what you like. Do you like condoms that are extra thin? Do you like ribbed condoms? Definitely trying out can be fun. And also seeing like what works for you and your body. And again, some people do have latex allergies or are sensitive to latex. So that's good to also be aware of. Are you someone who can deal with latex condoms or do you need non-latex condoms? Non-latex condoms, some people say like, well, they do smell a little different. It is a little bit more stronger, but some people do like non-latex condoms because they can add more heat from the friction. So some people like that as well. Some people ask about lambskin condoms. Yes, it is made out of skin, lambskin. Those condoms do prevent pregnancy, but they do not prevent STIs. That's because they're porous, right? It's made out of skin. So we don't recommend lambskin. But if people are going to use lambskin, they do prevent pregnancy. They do not prevent STIs. Yes, IHS has them for free too. There are 2 types of condoms I forgot to add as well. There's flavored condoms and there's non-flavored condoms. So obviously our anuses don't taste anything. Our vaginas don't taste anything, right? That would be gross if our anuses could taste stuff. Anyways. So no, the only thing on our body that does have taste sensory to taste is our mouth. So flavored condoms, you want to try to stick to using flavored condoms for oral sex and non-flavored for vaginal or anal sex. But if all you have is flavored condoms and you want to get down and have vaginal or anal sex, go for it. Use flavored condoms. If that's all you got, it's better than nothing. All right, so we'll move forward. Feel free to keep those questions coming if you have any. So ways to avoid or reduce the risk of contracting an STI. No risk would be not having sex, which is abstinence. And you can practice abstinence at any time in your life, even if you have had sex. It's just basically not having any vaginal, anal, or oral sex. Masturbation, so no risk would be solo masturbation. You can't give yourself an STI. But if you are masturbating with another person and hands are going back and forth, obviously fluids can transfer, also, skin to skin contact. That's how STIs can be transferred. So just be wary of that. Some risk, external and internal condoms, they are very effective. But if used the wrong way, or if people are using old condoms or anything like that, that can definitely reduce the risk or the efficacy of those condoms. Dental dams, some risk just because sometimes people, might slip, might not use it correctly. We add communication here because we want to make sure that people are communicating their needs. Also that communicating when they've gotten tested, right? If we're in a new relationship, if we broke up with someone, we want to make sure that we're communicating using condoms, communicating getting tested, communicating our status of STIs. And then vaccines and PrEP. So if you are a family who vaccinates or a person who vaccinates, You can definitely look into getting vaccinated, getting your Gardasil. They do offer it at IHS. PrEP 2 is available pretty much everywhere. Planned Parenthood offers it, Department of Health, IHS. A lot of Native health clinics offer them as well. And I believe it's for 15 years and up. Okay, any questions so far? Okay, we'll move forward. Real quick overview of birth control. What time are we at right now?
We are at 12:50.
12:50, okay, doing good. Oops, sorry, I gave you the answer. Okay, so what is birth control? It's a method used to prevent or to help plan the timing of pregnancy. So just a quick overview, you can find this at Bedsider. I do recommend Bedsider or PlannedParenthood.org for more information about different types of birth control. Bedsider has a really cool like picture with all of the birth controls, and you can just click on it and it tells you how they work, the efficacy rate of them as well. But this chart does a pretty good job too. So at top, you have the long-acting reversible contraceptives. So these contraceptives can stay inside someone for a couple of years. We have the implant, the IUDs, and then also sterilization. The only one that has no hormones in it is the Paragard, which is the copper IUD. But a lot of these birth control methods do have hormones. And what the hormones do is they go into your body and they go to your egg or your ovaries, and it tells the ovaries to stop releasing an egg. So that's how it works. So as long as people are taking their birth control, usually people with the birth control are not releasing any eggs, meaning when the sperm goes inside, there's nothing to fertilize because there's no egg coming out. So that's how hormonal birth control works. And in the middle, we have pills, patch, ring, and depot shot. They're okay. It is a little bit easier for someone to get pregnant because if someone skips a day on their pill or they skip a week on their pill or a couple of days, that's when someone can get pregnant. The patch can stay on someone for 7 days. After the 7 days, they'll peel off the patch, put on a new one. The ring can stay inside someone for up to 21 days. It's just like the ring that was inside the internal condom. It's very flexible. It just hangs out inside the vagina. And then the depot shot, that's going to be a shot of hormones, and that's going to be inside someone for up to 12 weeks or 3 months. And after that, they have to go back in for another dose if they want to continue with that method. And then down below, we have the not so well methods. Withdraw. We know that one doesn't always work because not everybody withdraws when they should. So that one can be very risky. Also with the withdrawal method, if people do withdraw, sometimes pregnancy can happen from pre-cum. So pre-cum comes out before the main cum. Pre-cum or pre-ejaculation is going to be the lubricant that lubricates the penis. It's getting the penis ready for the main ejaculation to come through. So that when the main sperm, the semen comes through with the main ejaculation, there's no issues. And I see we have a question in the Q&A. Trevor, can you let me know what the question is?
Hey, Becki. So the question was, where does the egg go, or does it still get released?
The egg just stays inside. It doesn't get released. I hope that makes sense. It's not harmful or it's not, it's not unhealthy or it's not harmful. So the hormones, it kind of tricks your body into thinking it's pregnant. So when you are pregnant, you're not releasing any more eggs because of those hormones. So it's the same thing. As long as you're taking the hormonal birth control method, it's just telling your body to not release any eggs. When people aren't taking any hormonal birth control and people are releasing those eggs, your eggs just gets reabsorbed back into your body. Great question. Thanks for the question. Where was I? Withdraw. So, like I said, if people don't pull, sometimes people don't pull out when they're supposed to, so they do ejaculate into their partner. And then also pre-cum can carry leftover sperm inside of the penis, and that can fertilize an egg as well. The diaphragm, not so popular anymore. It can be kind of risky because sometimes sperm can go around the edges of the diaphragm. So sometimes people put spermicide inside the diaphragm to help. And let's see, fertility awareness, that's keeping track of when you're ovulating, when you're not ovulating. That can be risky too, because it all depends on your body temperature, your health. Sometimes you have to check like the fluid from your vagina. So that can be a little bit tough, especially for people who are busy, you know, with jobs, school, or taking care of kids. And then condoms, you know, it's only there for not so well because sometimes people don't use condoms correctly. Like I said, if people are using old condoms, condoms with holes in it, or they don't leave room for the reservoir or for the ejaculation, that can really reduce the efficacy of that condom. Does anybody have any other questions around birth control or any of these methods? I know Plan B isn't on here, and that's going to be, people ask, is that like an abortion pill? It's not. It's a prevention pill. So what Plan B does is it works really quick. It's a high amount of hormones. When someone takes it, it goes straight down to those ovaries and tells those ovaries not to release an egg. All right, so it's just a pregnancy prevention method. Okay, so we'll move forward. Feel free to ask questions. And then I said I was going to talk about fries. So the way at Planned Parenthood, the way we like to talk about consent is that it's freely given. It's reversible, so people can take back their yes if they're not feeling it, if someone's feeling uncomfortable, or maybe they just realize, you know, I don't, you know, whatever the reason, it doesn't matter. People can definitely reverse their consent. It's informed, right? So we want to make sure that we're informed on what we're doing. Enthusiastic. Yes, I want to have sex. Yes, I want to kiss you. Yes, I want to go to the movies. Whatever the action or whatever event we're doing, we want to make sure that we're giving consent and we're enthusiastic about it. Specific. So this one I think is super important, right? I'm pretty old, and when people say Netflix and chill, I think we're just going to watch Netflix and eat popcorn. But to some people, it might mean we're going to get down and have some sex, which how would I know, right? You said Netflix and chill. I think what that implies, Netflix. So you want to be specific, let people know like, hey, do you want to have sex? Do you want to go upstairs and have sex? Whatever. You want to make sure that you're being specific about what you want to happen. Does anybody have questions about consent? Okay, I see in the chat, what would you say to teenagers who have been dating a few years? Get consent every time they have sex. Yes, even if you've been dating for 20 years or married for 30 years, you still want to make sure that you're asking for consent. Now that can look different for people who have been like in a long-term relationship, but you definitely want to make sure that you're consenting to having oral sex or having vaginal sex or anal sex. Maybe that means like, hey, you want to go to the bedroom and you both kind of know what's going to happen. That's going to be consensual, right? If you're forcing someone or trying to coerce someone into having sex with you, that could be, that's abusive, and that's usually rape or sexual assault. If people are saying like, I'm going to break up with you if you don't have sex with me, that is definitely not okay. So we want to make sure that we're letting people know that it's enthusiastic or, it's informed, it's specific, and it's definitely reversible. Was there a hand raised? No? Okay. Okay, so I do have some questions or some conversation questions because I want to talk about segs. What kind of boundaries do you hold for yourself when it comes to romantic relationships? Feel free to put it into the chat or unmute yourself.
I'd say raise your hand and then we'll try to unmute you.
Oh yeah, raise your hand. Anybody? Both getting tested. I love that. Yes means yes and no means no. Definitely. Both getting tested before actually having sex. Awesome. Love it. I have another question. Is it easy to accept a no from a romantic or sexual request? Feel free to raise your hand. I see yes, it should be. Abe, do you want to talk about it? Can we unmute Abe?
Yeah, let me see if I can. Okay, should be unmuted. Or asked to unmute.
Abe, can you? Hello? Oh, my computer's a little old. Oh, no worries, Abe. It's okay. It should be, right? But a lot of people, you know, I did this presentation with the college students, and, you know, a lot of them said that it was scary. Not scary, but hurtful, because it comes off as rejection, right? And so it's important that people get comfortable with accepting a no, or make sure that people are comfortable with, yeah, feeling rejected. And it doesn't feel good, right? We know that we should accept a no. It's like we definitely have to. And I believe someone said, or else it's rape or sexual assault. If you don't, that's a definite. But also to know that with those feelings, a no can sometimes be hurtful and uneasy, but it's good to be comfortable with that, to know that that is going to happen. Because either, you know, even if it is a romantic or a sexual request, when I get a no from my friends who don't want to hang out with me, it does hurt. It does feel painful, but I need to expect that, right? I need to know that this is what it feels like. Okay, I'm going to move forward. Maybe next time they'll go to the movies with me or they'll want to hang out. But right now I'm going to accept this no. So that's definitely a good way to talk about it with young people, because I know some young people who are like, you know, I want hot Cheetos. I want hot Cheetos. And you say no, they're not going to accept that first no, right? They're going to keep asking and asking and asking. So it's good to let young people, especially if they're toddlers or younger, to let them experience what a no feels. I said no once, you know, you need to respect my no, so that they know that when someone says no, it means no. All right. So what's important to you when it comes to a healthy relationship? What's a value, or, you know, yeah, what values are important to you? Honesty, open communication, respect, loyalty, respect. honesty. I love it. I like the open communication too, right? I think it kind of goes to Kavanda's comment about, I think there needs to be an understanding of what kind of relationship or connection it is, like everything's up front, because if it's only sex for one person, that should be known to both people. A lot of, if there's no communication in a relationship, there's room for a lot of miscommunication, right? So we want to make sure that there's open communication, making sure that you're honest with a person, right? If someone is being unfaithful or stepping outside of the monogamous relationship, that they let the other person know. That way that they can both get tested for STIs if that's the case. Consistency, I like that. I like that. All right. Is there pressure to be sexual in general? Sorry, I spelled that wrong. Understanding. Oh, I like that one from Effie. Facebook. Is there pressure to be sexual in general? In today's generation, yes. Where do those pressures come from? Yes, social media and peers, right? There's that external coercion from media to be sexual. And sexual, not just meaning like I have to have sex, but also like having to have that gaze over you, the male gaze, right? That's one of them. I have to look sexy. I have to look nice. I have to do this and do that. I have 4 teenagers and they all tell me that their friends think sex is what makes a relationship. Oh, yeah, right? Because that's what let's in TV, that's in social media, right? It all comes down to being sexual, physically sexual. Thanks, Abe. Yes, hypersexual things on social media for sure. I'm kind of new to TikTok and it is intense sometimes. I have found that teens think that dating is sex, and once you have sex, you're committed. The lack of mental connection with your partner nowadays. Yeah. It's intense. It's super intense. Yeah. It's not only physical, definitely. Are brown and black bodies hypersexualized? Girl. Does a bear poop in the wind? You got me there, Abe. Yep. Yes, yes. Yeah, and like I said, I'm new to TikTok, but it's scary with how hypersexualized a lot of brown and black bodies are, especially when we talk about Indigenous bodies, Indigenous women. There's that fetishization of Native women. There's a huge fetishization of Asian women. You know, I do a couple talks on sex trade abolition, just the sex trade industry in general. And it's scary about with the amount of violence that brown and black bodies face and the discrimination that they get. It's really hard for people who are in those marginalized communities, who are economically unstable and rely on the sex trade, how hard it is for them to exit the trade, right? If you look at the hypersexualization of brown and black bodies, you can look at the different topics in porn. There's a lot of fetishization on Asian women, on Black women, and also just in general sexual violence, right? There's a lot of rape fantasies on porn. There's a lot of incest, pedophilia with a lot of porn too. So that's definitely a trend and also something that's perpetuating sexual violence in our community. It's normalizing that sexual violence because, hey, it's important. And when people rely on getting off or orgasming to violence in porn or fetishization in porn, that's going to be, that's pretty heavy. And once they go out into public or get into different types of relationships, sometimes those sexual relationships can be violent because of what they have, because of what they get off to, right? What they ejaculate off of. So yeah, sorry, going on a tangent, but just in general, yeah, bodies definitely do get hypersexualized. Oh, I love it. Brown and black is beautiful. Yes. Okay, so that's enough with the question segments. Well, I want to ask this one to everybody. What does sexual liberation look like? Feel free to put it in the chat or raise your hand. Free. Abe, does your mic work? It's okay. Free from abuse, definitely. I like that. Joyous. When I think of liberation, I think of freedom, definitely. Consensual. Comfortable. Teaching our young people to respect their bodies and what consent is and how to take care of their bodies and say no. Yeah, I think that's super important. We teach people to say yes and to always respect a yes, but it's also important to teach people how to say no, right? Because sometimes people, and this happens with a lot of young people, especially young girls, their self-confidence is very low, especially being a teenager. So teaching them how to say no, refusal skills is super important because sometimes people can easily get coerced into having sex, right? And they don't know that that's sexual assault right there or rape. Love it. Yeah, I love Terry's answer too. Okay, so I'm going to move forward. We're at the end and I want to ask, does anybody have any lingering questions? It can be any kind of sex ed questions too. Feel free to ask. While you're thinking about questions, here's the contact info. If anybody has any contact information or needs any contact information from me or the Native Community Health Network, feel free to email us.